privilege to be presenting before this August audience, and I thank Venus International Foundation for inviting me for this nice event. I bring some data, a little summary of our work from over the years, and I've had a privilege to work for a long time at All India Institute of Medical Sciences in New Delhi, India, and then for the last decade or so in Canada, Ontario, Canada. So I will present a small summary. I was not very sure of the amount of time I will have, but I will try to kind of consolidate everything and provide an overview. I do not have any financial disclosures or conflicts of interest to declare, and here are my acknowledgements. It's only because of patients and families and students and colleagues, as well as mentors, apart from the funding agencies that have contributed to the work that I'm about to present. And last but not the least, it's my family. My husband is out here. He's been supporting me all through. It's not without him and my daughter and the rest of my family that I would have been able to complete even half of this work. So epilepsy is a very common public health problem, not only in terms of reduction of working hours or working population, but also in terms of mortality risk. So this is from the summary statement of the WHO from a few years ago. It is estimated that the burden of epilepsy is such that about 50 million people across the world, and about a 1% lifetime prevalence is seen across the world, and hence it is very important to recognize that treating epilepsy is an important public health priority. Not only does it cause seizures, which is brief loss of consciousness or other problems, but there's also tons of comorbidities, and that is what I'm mostly going to focus on. And as I mentioned, there's also tons of mortality risk. And so we need to recognize methods to improve epilepsy outcomes in the population. Now, the link of epilepsy with sleep has long been recognized, and it's from our own ancient knowledge systems here in India that we have this Nataraja Murti. I think this is one of one beautiful one that we saw at Brideshwara temple in Tanjavur. And but there is this very characteristic little demon under Shiva's foot, and that is apasmara, and it kind of translates into loss of memory or consciousness, and that is kind of that is also the term used for epilepsy in Sanskrit. And then there is on the left, you can see there is a summary of what is mentioned in one of the smaller Upanishads, Mandukya Upanishad. And so the whole talk about the four states in which we are, the waking, dreaming, deep sleep. So you can see that during wakefulness there can be seizures, during deep sleep there can be seizures, not so much during dream sleep. But then there is this whole silence, the state of turiya, which for most of us is evasive, but that is what is represented by Shiva, the supreme consciousness. And so that link is kind of there. It's intriguing to begin to recognize how we've missed out on research in that field. So very quickly, so for anyone working around people who have epilepsy, and because of the high prevalence, majority of the people would know somebody or the other who has had epilepsy. And so sleep is a major problem in that population. However, research has not focused so much on the sleep aspect, which is kind of interesting. And so our work has been to explore this link and how we can target sleep to improve epilepsy outcomes. Here's a little summary of how much literature is available, and I'll skip through many of my slides, so please pardon me for the speed. So when we look at outcomes in epilepsy, when we treat epilepsy, how people do. One really important thing is seizure outcome. So that is the main thing. There are these brief lapses in consciousness or wakefulness and sleep. So there were some who had wake time seizures. This is ongoing work, but we've actually begun to identify that when we record epileptiform or abnormal activity on the EEG, high density EEG, it is much better localized. It provides us much more meaningful information during sleep as compared to wakefulness, where it's much more widespread. The question that we have tried to address is whether treatment for drug-resistant epilepsy can influence sleep quality and architecture. So we've been looking at how sleep will affect or influence people living with epilepsy and how it will have a role in their treatment. But if we treated epilepsy well, can that improve their sleep quality and then in that cycle further have a beneficial effect on seizure control? But he was not doing very well otherwise, cognition and stuff. So we brought him into our monitoring unit in the hospital, and what we found was during wakefulness he was fine. So this is kind of a normal looking EEG. During sleep, however, there was this very, very